which I want to bring to story hopefully through some of the photographs of the projects that we're working on in India, Kenya, and Ghana. There's two verticals that we've decided to bring attention to as a starting point. One of them is distributed water solutions, water systems. Think of it as a micro-utility where we are inserting or installing a water purification plant in villages, providing affordable water to these populations. Then the other vertical is rainwater harvesting, much lower tech solution, but incredibly important to the populations, particularly in drought-stricken parts of the world. And there's hundreds of millions of people who are impacted on a daily basis by their limited availability to access water on a reliable basis. Is there a technology person coming? Okay. Is anywhere in the room? The two corrections I mentioned earlier that Governor Whitman had said, one is each of the board members have contributed $500,000 apiece to this project, and we've subsequently raised another $7 or $8 million. It's still a very modest amount as you think about the challenge and the issues needed to be addressed. And then the other one is that they've all stopped celebrating their birthdays about, a few years ago. So the reference to 80 years plus may not be quite relevant. I think some of you will recognize some of the names of the individuals that have engaged in this project. The other, much of what we're doing is also through partnerships, and maybe I'll take a moment to talk about that. We have three key partners with our work. Pepsi-Cola, it's a major funder. It's also contributing operating and market expertise and capability. One of the big gaps that exists in this sector is the ability to provide sustainable solutions, operations and maintenance capability to make sure that these distributed water purification plants continue to operate effectively over time. And I think many of you who might be familiar with developing world challenges, there's been tremendous amount of dollars spent over the years putting in plants, water purification plants, drilling bore wells, and other solutions, much of which over time have fallen into disrepair and neglect because of an absence of the ability to maintain these systems. So a partner like PepsiCo, which has extraordinary capability as it relates to getting product out to the field, managing distributed solutions and systems, they have an ability to really bring in that technical know-how and operating know-how to help us think through those challenges as it relates to providing those enduring solutions. Another key partner in India is Ratan Tata Trust. I think many of you are probably familiar with Tata companies. What many of you may not know is that about 70% of Tata company is held in trust, and they do just immense work to social benefit across India. Water is one of their key priorities, and they've partnered with us to identify solutions for water enterprises. Johns Hopkins University is another key partner of ours. I think you heard from Dr. Kellogg Schwab yesterday. He's the director of the Center of Water and Health. He's been really critically important in engaging with us to identify intervention strategies that are going to deliver the desired health and socioeconomic outcomes that we're seeking to pursue. And I often hear from people, why do you spend money on public health surveys and impact assessments? If you deliver water, it's going to provide health benefit. But what's remarkable is that there's been an extraordinary gap in evidence-based research to really understand what's working, what's not working, and what the most cost-effective solutions are. So I'll take a moment to explain some of that. And I'm still going to try and keep this within my time limit, So I'm going to go through these slides extremely quickly, but at least highlight some of the key points. Okay. As it relates to capacity building, key focus for us, again, on the ground, how do we align local needs with the most viable, cost-effective solutions? There's lots of organizations doing great work out there, but they often don't have the toolkits to really identify what the most effective solutions are. So we're doing a lot of work around identifying and matching needs with opportunities. Water resource stewardship, we've heard a bit about that today. Address local cultural and political barriers. Sustainability challenges around maintenance and operations. Quality standards for potable water supplies. Another area where PepsiCo comes into play. They know how to deliver water at standards. Consumer programs to build demand. There's a lot of behavioral issues around water provision. How do you ensure the purity, the proper handling so that the water purity is maintained? And then a big one, enabling access to capital and funding. I think you've heard plenty about the devastating consequences and the social impacts of water. I'm going to just quickly jump to the gaps that we're looking to address. Scalable, sustainable models, more coordination of donors and groups implementing projects. There's, again, lots of work happening. It tends to be highly fragmented and not particularly well coordinated. How do we align appropriate technologies to interventions? What are the, again, consumer behavioral challenges, private sector engagement? We as an organization, small organization, but domain expertise, deep domain expertise in terms of delivering solutions and developing commercial strategies. We're focused on project opportunities in systems, technologies, operating models, and funding models, and have a research agenda that's complemented by field activity. I mentioned projects in India, Kenya, and Ghana. Our research agenda includes developing the appropriate models, intervention strategies, pricing, many of the things that I covered a few moments ago. Okay, so just some pictures to bring this to life. Project in Ghana, we're working with Water Health International. This is a water health center. Think of it as a micro-utility. It's locating a water purification plant in the middle of a village. The water is piped from maybe a kilometer or two away, typically surface water, processed, and then sold for a competitive price, lower than much of what is available in terms of pricing. More reliable source, higher quality, and a sustainable proposition as it relates to operating and support components of the project. I mentioned behavior change before. A key component is it's one thing to give someone pure water, but it's critically important that that water is handled properly by the recipient. And so there's a very important emphasis as it relates to informing the community about the benefits of water. It's also demand generation. Once they come to appreciate the benefits of water, they're more apt to demand it and, in fact, purchase it. This is the point referencing payment for water. I think we just had a snag there. Here's a initiative in Kenya. You can see a Skyjuice hydrant. It happens to be a Siemens product, which is installed in a water kiosk that we've helped to deploy outside of Nairobi. We have a photograph of Ravi Sevak. He's a member of our team recruited out of PepsiCo. He was responsible in India for developing a service network across India to maintain distributed systems. So they're refrigeration units, point-of-use fountain drinks, putting that know-how to work so that we can, in fact, maintain these distributed water purification plants is critical. And this is an example of a training activity with a local operator. Quality assurance programs are critically important. How do we maintain the purity of the water and standards within the actual plant itself? I will just make a couple summary comments and then turn it over to the other panelists.